Admission, there was 100 to 300 cc's of blood from each chest tube? What does that mean?
That's the output they got once they put the chest
Sorry
tube.
again, just can you keep your voice?
That's the output they got once they put the chest tube in?
Okay. So when they put the chest tube in, it drained 100 to 300 cc's of blood, is that correct?
Correct.
And then after that, again, shortly after admission to the hospital, coming from South Shore Hospital, she then got a massive transfusion protocol, which you told us about, right?
Yes.
And what does that mean?
Means she gets, we have a protocol that with blood, depending, blood products,
Okay.
she gets infused rapidly.
And was there a notice shortly after arrival to the ICU, she was being turned and had 30 cc's of clear fluid that came out of her nose, is that right?
Yes.
And what is that? Was there a suspicion that that was what's called CSF?
Yes.
And what is CSF?
It's spinal fluid.
Okay. Going to the next page, which would be 19, does it indicate, again, on there, if I can just bring this up a little bit better. So she now has noted acute blood loss, anemia, right? What does that mean?
She has a low blood count.
And do you know what happened to the blood, or any idea?
I do not.
So she had very low, lost a lot of blood, right?
Yes.
And she had anemia. That would be what, low blood or something?
Yes.
And she required multiple transfusions immediately following her arrest, right?
Yes.
And when it says arrest, does that mean arrest by the police, or does that mean the cardiac? I want to make sure that's clear. It's cardiac arrest, nothing to do with the police, okay? And she had required multiple transfusions. And you were there for that, correct?
Yes.
Were you aware of the extent of after you had the after you had the MRIs and the CAT scans, were you aware as the lead nurse or treating nurse as to what the extent of her injuries were?
At that point, I don't believe so.
All right. At some point, did you become aware of that?
Yes.
Okay, so, and again, I've got the records, you don't, so let me do it this way, just to make it easy. Do you remember that she had a burst fracture of C1?
Yes.
What does that mean?
Means a cerebral fracture.
That'll be up here? So this is the cervical spine
Cervical.
up here?
Mm-hmm.
And then T5 and T6, there was a transection. What does that mean?
Thoracic.
Okay, so
On the spine.
down here.
Yeah.
And when it says transection, what does that mean?
It's severed.
And then T1, 2, 3, 4 also were injured as well, right?
Mm-hmm.
What is neurogenic shock? What does that mean? If you know.
Neurogenic shock.
Sorry, yeah, neurogenic shock. It just makes reference on.
These are not my notes, so I can't really.
That's fine. I understand. And this would be on page 65. Do you recall reviewing the documentation as to what's captioned present illness in the records?